A mutated version of COVID-19 appears to be mostly infecting children. It's been nicknamed the Cicada variant. National Medical Director Dr. Natasha Bouillon with One Medical joins me now. This is really alarming, and especially the fact that it affects mostly children. Why is that?
Yeah, so it's because children are mostly immunocompromised, and what we're seeing with the Cicada variant is that it has 75 mutations on the spike protein of the virus. And so this variant is quite different than variants of the past. Because of that, what we're finding is that past infections are not really helping our immunity because we don't have antibodies to them. Scientists also think that the vaccines in existence are probably only partially effective because the current vaccines are against the JN1 lineage, and it's a different lineage. And so because of that, we have to be more aware. We are seeing cases spread across the US. And the other thing I tell people to be aware of is that it can still cause long COVID. Even though it's more rare, 3 out of 100 cases still end up in long COVID. So you don't want to get a COVID infection.
Gosh, I feel like we haven't talked about long COVID in so long. That was such a huge concern.
And it's still
at the
out there.
beginning.
Yeah.
Okay, so talk about the symptoms we need to be aware of.
Yeah, so the good news about this variant is that the symptoms are not more severe. So even if we're starting to see more cases, they're not actually more severe. More people are not ending up in the hospital. The symptoms are typical. They're fever, cough, runny nose, sore throat. But because of that, the symptoms can mimic things like allergies, the cold virus, or a flu. And so if you're having any of these symptoms, it's important to get tested to distinguish exactly what you have and exactly what your kids have.
And when you say get tested, is that the same thing with the swab and what we used to do when it first broke out?
So you can still do a rapid swab test. And so you can do that at home. You can get a test result in a couple of minutes. And now we also do have things like rapid flu tests. And so there's a lot of at-home testing that people can do, and you don't actually have to go see your doctor to get those results.
Okay, talk about how people can stay safe and just avoid it.
Yes, and so it's really important to make sure that we're washing our hands whenever we go out, whenever we stay at home. If you are somebody that's immunocompromised, I do recommend, being careful about crowded places. If you are in crowded places, make sure that it's well ventilated because we know that COVID doesn't transmit as easily in well ventilated areas. And of course, the most important thing is stay at home if you are sick. I know people are still out there powering through sicknesses. If you are at home, stay at home. If you're sick, stay at home. It's for you to rest and recover, but it's also so you don't get people sick around you. And if you have any additional questions, if you are high risk, talk to your primary care provider.
All right. Always excellent advice. Thank you so much, Dr.
Thanks so
Bouillon.
much. Yes.